So this is a typical MRI of a brain tumor patient. You can see a large contrast-enhancing tumor. And after neurosurgery, it looks great. The tumor has been removed. There is no sign of tumor left on this MRI. The patient goes home. However, the tumor always comes back. And this is where my research starts. My name is Benedikt Wiestler, and I'm both the responsible neuroradiologist for brain tumor imaging at the TUM University Hospital and a professor for medical AI at the Technical University of Munich and a principal investigator at the Munich Center for Machine Learning. So the type of tumors that we work on are called gliomas, so tumors that originate and grow in the brain. And unfortunately, these tumors are not a solid ball or a mass. Rather, they are really diffusely infiltrating tumor that invades the surrounding brain and the surrounding healthy brain tissue. And the core challenge for us is that even with the most advanced imaging methods available to us, high-resolution MR, PET imaging, intraoperative microscopy, we are limited to seeing only some extent of the tumor, so only the main tumor mass. However, what we're missing and what we're crucially missing is this diffuse infiltration. And these diffusely infiltrating tumor cells, they are actually the root of recurrence, of therapy failure, of the tumor coming back and recurring, and ultimately limiting the patient's prognosis. So what we do next for this individual patient is we will plan his or her radiotherapy treatment. Radiotherapy is always applied because we know this is our best way of treating this invisible infiltration. But how do you target something that you don't see? Our solution and our imperfect solution and the clinical state of the art at this point in time is taking the resection cavity, putting a roughly 1.5 centimeter ball around it, and then irradiating this entire volume. We know that this way we will undertreat parts of the tumor. So parts of the tumor will not be contained in this treatment field and they will not be treated adequately. And we also know, on the other hand, that we overtreat the healthy brain. There are parts of the brain in this volume that do not require treatment, but it gets irradiated anyway. And we do this undertreating the tumor, overtreating the brain, unfortunately at the same time for lack of a better alternative. So on this image, we see the typical appearance of a brain tumor growing in a patient. We can see that this tumor grows over time. You can see the contrast-enhancing core in the center of it. This is what we also see on MRI, and this is what we're targeting right now. But crucially, you also see a cloud of tumor cells around it. And these are the individual tumor cells that we want to target with our model and later with therapeutic approaches. So we have developed these models that help us to visualize the tumor spread. But we don't want to stop there. We want to do actually two things. First, on a research perspective, we want to build a time machine. We want to equip these models with the capabilities to simulate also individual treatments and how the tumor will respond to them. This will put us in a place where we can simulate for one patient treatment A, B, C, and then pick the single treatment that works best for this individual patient. So really personalize our therapeutic approaches towards one patient. And on the other hand, I'm a clinician. I really want to help my patients. I want to improve the prognosis of patients with brain tumors. So what I want to do is I want to take these models from the lab, from the bench, so to speak, and bring them into clinical practice. So we want to take these models together with our partners at the Neuro-Oncology Center at TUM University Hospitals into a first clinical trial where we use these models to derive treatment strategies, to personalize and tailor treatment strategies to an individual patient and compare this with the state of the art to hopefully show that our models meaningfully improve treatment and prognosis of brain tumor patients at TUM University Hospital.